we are taught. It is about the real human experiences and real life journeys where I discuss the life stories of dentists who have accomplished a lot more than just being a dentist. So today in this episode, I'm being joined by Dr. Sunita Pradhan. Dr. Sunita Pradhan's journey is anything but linear. From starting as a practicing dentist to moving into health insurance, hospital marketing, co founding dental creations, and launching the Gourmet butter brand Little Treats, and now consulting dentist on digital authority, her career is a masterclass in reinvention. With a BDS and management credentials from XLRI, she blends clinical understanding with strategic branding. Today, she helps dentists transform expertise into trust driven digital brands while also hosting conversations that simplify dentistry for the public. Her story is not just about pivoting careers, it's about evolving identity, courage, and redefining success at every stage of life. Please welcome Dr. Sunita Pradhan.
Thank you, Andali, for this warm welcome. Um, I'm not sure I'm worthy of so much praise. I've just done what I thought was best. So, yeah, I can't wait to share my experiences with your audience.
I'm sure everyone who's looking to change their career will find inspiration in your journey, ma'am.
Let's start.
So, many professionals fear changing paths, ma'am. What gave you the courage to jump from dentistry into corporate roles?
So, I graduated from dental college in the year 2000, and having completed 1 year of internship, I did practice as a dentist for around 3 to 4 years. But what I realized in those 3 to 4 years is that I felt extremely stagnated. I felt like I was not growing as a professional, and I felt that I was underperforming. I was not really happy with the kind of work I was doing. And beyond a point, clinical dentistry didn't fascinate me that much. And so that was my cue to start looking for something else that I could do. And that's how my journey began.
Yes, ma'am. Like dissatisfaction with dentistry is a bit, even today, it is on the rise. And we see many dentists who are changing from dentistry to the corporate roles. And there are many courses that are being provided to do the same. But I guess it took special courage for you because back in 2000, there were not many dentists in corporate roles
Yes,
who are as much. Now we are seeing an increase. I think maybe it's due to career dissatisfaction and being stuck in an operatory for such a long time. You feel
yes.
confined. How has been your entrepreneurial journey, ma'am? From corporate roles directly into entrepreneurship with little treats. How has been your experience there?
Um, I'd like to start by saying that entrepreneurship opened a whole new world for me. So, I am from a business family, and the business aspects of things has always excited me more. Now, when I decided that I wanted to start my own business, what I did realize is that a lot of things came to me instinctively, and I felt that I should capitalize on it. It was a journey that was fascinating, exciting. Uh, it was a new journey, unfamiliar territory, lots of learnings. I will stay away from using the word failures. I will say I learned a lot through those experiences, but it was one of the most exciting phase of my life.
Yes, ma'am. Entrepreneurship gives a different level of satisfaction than being,
Yes.
able to answer to someone else. We are accountable to ourselves, ma'am. So, how did from corporate roles to little treat? Why gourmet? Why butter?
I've been asked this question many, many times in the past 8 to 10 years. So I was on a break of sorts at the time because I was raising my kids. I have two boys who are 3.5 years apart, and so there was I spent substantial time caring for them at home, and there used to be breaks in between. I was not able to be very consistent with work. Uh, so during this period when I was helping, when I was raising my family, I could feel that sense of frustration building up, that I was not doing enough with my capabilities, enough. There was nothing challenging in my life. It had become a routine, right? And I I got tired of blaming my circumstances. I think all of us at some point go through that, right? Where we play the victim card and say, okay, why is this happening to me? And beyond a point, I got tired of it. And I felt that I had to make some radical change if I needed to move ahead in life. And then decided, why not try to do something, start my own business and work within uh, the time that I have, work in a way that suited my convenience. I enjoy cooking. I'm extremely passionate about cooking. And while raising my kids, I was very particular and very anal about giving them good home cooked food. Uh, if there was an option between making something at home and getting it from a store, I would first try to make it at home myself. And that's when I started exploring different verticals in the food market. And I realized that flavored butters was something that was quite popular in the West. But in India, it was not something many people were aware of. It had not caught on in a big way then. I'm talking of 2015. And the fact that butters condiment, or butter as an ingredient rather, that's easily available in most Indian households. We all have butter in some form lying in the fridge. I put two and two together and said, okay, why not come up with Indian flavored butters? The butters that you see outside in the market, in gourmet stores, are all Western flavors. Yeah, made there are clear Western influences, but I didn't find at any point anything that catered to the Indian audience. And
Okay.
that's when I started developing my own line of Indian inspired flavored butters. That's how the idea came along.
That was really innovative, ma'am. Actually, even now, I don't think there is a brand which is doing Indian flavored batters right now. So I think coming up with that idea was actually a genius move that time. So, ma'am, of all the roles that you had, which phase felt the most satisfying and why?
Obviously, being an entrepreneur and founding Little Treats, uh, that's because it's like I nurtured a baby. I think of it as my third baby. Uh, it was the most satisfying phase also for the reason that I was totally out of my comfort zone. I was working in an industry of which I had no knowledge. So I had to first learn about the industry. I learned everything on the job. I learned as I went. And like I've said before, it was one of the most exciting phases of my life. I've learned so much from that.
Actually, most of the founders say that their business is their baby. Like we get so involved in that, so
Yes,
emotionally attached. It's like we nurture it, like we
yes.
nurture our own. So, ma'am, did you ever struggle with identity when your career kept evolving?
Uh, I'm going to answer that question in two parts, right? So, initially, when I started out, yes, there were many times when I had like an identity crisis because I'm a dentist, a doctor, but there was a started off working with a health insurance company, working in a hospital, working in a Apollo clinic. A lot of times, uh, it felt confusing. It felt like, okay, what am I doing here? I'm actually a dentist, and I shouldn't be doing this. Sometimes it involved doing back end work. Sometimes there was administrative work. So initially, in the first few years of my uh, journey, yes, there was confusion. I will not deny that. But as more and more time passed, and especially once little treat was born, uh, I no longer had any kind of confusion. I just embraced my journey. And if people ask me, but you're a doctor, and what are you doing in the food industry or in the, entrepreneurial space? I said that this is what interested me, and I'm here. I'm working on something that's very close to my heart. So from confusion to acceptance, that's been the journey. And yeah, I have no qualms today about telling people that I'm a dentist.
Actually, ma'am, there's a saying that a doctor can be anything, but not anyone can be a doctor. So
Yes.
I have earned the title of doctor. We have studied so much. We have given our time, our strength to it. So I think whatever we may do in our life, we deserve the title of doctor.
Yes, very much.
So these days, many dentists and many people are starting second careers or a side hustle that they are interested in. So, do you believe careers today should be linear or multi potentiality is the future?
I think each to his own.
Hmm.
Uh, I live by that. What works for me may not necessarily work for someone else. Uh, I felt that I was not performing to my full potential as a clinical dentist, and hence I decided to reinvent myself. But if a dentist is happy with the clinical work they're putting in, and there are many dentists who love clinical dentistry and who are just amazed at their ability to help people, help patients. Eventually we are helping people. uh, so I honestly think it's each to his own.
Yes. Like those who are passionate about one thing, they should follow that. Why
Yes.
keep yourself in a boundary of like if I'm a dentist, I should be a dentist only. If it doesn't work out, anyone should do anything they want in life. Then these days with internet, with everything, AI, everything has become easier, much more than it was like 10, 15 years back.
Yes.
So, ma'am, having your own journey with little treats, what did you teach? What did it teach you about consumer psychology that dentists should understand?
A lot of things actually. So when I started out, I came in with the notion that a product like a gourmet condiment, gourmet flavored butter, there would be takers only in the metros, tier one cities. And so initially, all my marketing activities were focused towards the tier one and metro cities. But as time passed, I realized that there was a huge customer base in tier 2 and tier 3 cities who couldn't get these kind of ingredients or condiments where they were, and hence they were ready to buy it if they heard about it, and they that a lot of them actually were shopping online. So that was a big revelation for me, and that changed the way we designed our marketing strategy. So I think what I think what dentists can learn is that we can't take our patients for granted. So while with the advent of the internet, many things have changed. many things. Patients are more educated, more aware of treatment options and procedures, and they know the options available to them. They know the pros and cons of a treatment. So I think we need to factor all of that in and understand that our audience right now is far more informed, they are well informed, they are discerning, and they know what they want.
Yes. Like I think rural areas and little towns, they're actually very underserved.
Yes,
Even by FMCG companies, I had read a report about Dabur that they are focusing on rural areas and tier three cities
yes.
because there was a opportunity to exponentially grow in that space. And I think even for dentists who say that it has become really competitive, they haven't really explored the rural market. And in modern in cities and all, they people cross judge you, but in rural areas they are more trusting of doctors than they are in cities. So I think if a dentist want to expand their footprint, they should see that about the rural areas, at least, surrounding the cities. If they can at least once in a day, if they run a satellite clinic, I think it will have a real big impact on their brand. So ma'am, you have
Yeah.
so at Dental Creations, you significantly improve patient engagement. So, what specific strategies are making the biggest difference?
See, I think first of all, educating your patient about treatment procedures, treatment options, what are the outcomes they can expect, and what with the advent of the so-called health influencers today, a lot of information is being given out by people who are not even qualified to be giving that
Hmm.
information. They are not doctors. They do not have the necessary expertise or the experience. So when a doctor talks about the various treatment modalities and options and educates the people. So,
Hmm.
what he is doing, he or she is doing, is that they are already building their trust and credibility with the patients. They're making sure that the patient gets educated with the right information. He's armed with the right information. There's no longer any ambiguity or anxiety in their minds, right?
Hmm.
Patient testimonials also are a great way, I feel, of speaking to your target audience, because you are addressing a problem that the patient came with. And it's, see, all dental problems at the heart of it, it boils down to them uh, having some kind of a problem in a basic area of function, not being able to eat properly, not being able to smile, or not being able to talk properly, or they come in with pain. I'm trying not to get too technical here as to what the actual cause was. So the general population identifies with these problems at some level. We all have gone through that. We know people who don't smile because they don't have good teeth, or we know people who are not able to eat properly because they have dentures which are loose. So once they identify with that, they know, okay, this is a problem which someone else has too, and they know now there's a solution. This is a possible solution for a problem that I share with another person. And the most important thing, people realize they're not alone. They're not the only ones facing a particular problem. And I think that kind of helps build confidence. Also, a doctor just turning up on social media, talking to his patients, let the patients know who the doctor is. It's not enough. I've seen people work with agencies, and they're posting regularly reels, carousels, posts, but
Hmm.
nowhere is the doctor seen. The doctor is not visible.
I think
It's
AI
I
first was so at the rise. Like I have seen even my colleagues, most of them they are just typing in the chat GPT, they're getting an image, they're sharing the same thing on the social media.
Yeah, so patients, people know that this can be churned out even by AI today. They want to know who is the doctor who will be treating me. Is this the person whom I can trust with my oral health, with my health in general? So I think that's what we do. We try to humanize uh, healthcare, try to build trust and confidence of the patient in the treating doctor, and make them feel that yes, we are in safe hands.
Hmm. Like with rise of AI, I think authenticity is much more important now.
Yes, very much.
Yes. So, like I would say, storytelling is also a big part of branding, digital branding.
Yes, yes,
And because how many times are you going to talk about dental implants? Like we can write about dental implants in 50, we cannot write about dental implants in 50 different ways. But we can say how dental implants have helped 50 different patients.
absolutely. I
And
agree with you because if you see the number of people who have come in with problems and then who have been able to go back to normal lives because of a particular treatment modality, that's so heartwarming when a patient says, okay, I was so scared of implants, but I saw a post or a reel about a person with a similar problem, and that increased my confidence, and I came to a dentist seeking treatment. So I think yeah, that's very empowering for the patient.
like they will know they are not alone with
Yes,
the problem. And your life changing stories travel at large.
yes,
Like a full mouth rehabilitation, it changes the patient's life. They are able to eat, they are able to smile. It gives them
yes,
their confidence back. But we have to convey them to the larger audience that this is possible for you. In a way, it is
absolutely.
serving our patients in a different way.
Yes.
So, how does storytelling reduce patient anxiety and it increases case acceptance?
So, we already kind of spoke about it, but yeah, uh, how does storytelling help is that first of all, the we leave the patient feeling more empowered with the right kind of knowledge and information from a credible person, from a person who has the experience and the qualification to talk about it, not just any health influencer who's picked things off the internet, right?
Mhm.
So there's no longer ambiguity in the patient's mind, ambiguity or any kind of anxiety, because once we have established that there is a problem, the patient is also empowered with information of what can be done next, right? So what this leaves the patient with is the correct information. And when the same patient comes to the doctor, be it a dentist or any other surgeon or general physician, the doctor no longer has to spend time convincing the patient of a treatment modality. The patient now is already aware of it. He's informed and he's coming to you for confirmation now. So the conversation shifts from convincing to confirming something. And
Hmm.
the patient comes with a more open mind, open to even starting a discussion about treatment and saying, okay, I am thinking about it. So therein lies the shift.
Yes. So, how can AI be beneficial in brand communication?
Yes, I've been asked this a lot of times. Now, the thing we should understand is that dentists or doctors, I'll keep it generic, doctors are not short on ideas, right?
Hmm.
I would like to think that they're short on time, right?
Hmm.
So, what AI can do is help them solve this problem. So, I've even seen this with friends and colleagues who think, okay, you know what, I'm going to start building a digital presence for myself. They put up a post and then there's nothing for 1 month.
Yeah.
Maybe another one and then gone for the next 3 months. So very erratic, no consistency. AI can help you solve that problem of consistency. So
Hmm.
you, when using AI, we have to remember that we are the masters. AI is just a servant who will
mm,
do as he or she is told, right? So let's say the doctor wants to talk about a particular treatment to create awareness, more patient awareness about it. He just has to type that in. He can get a post. It can be in the form of an infographic, it can be a flyer, or it can just be a post. Similarly, if the doctor is on various platforms, he can, with one command and the right command, uh, tailor content for different platforms. And
yes.
this is a saving in terms of time, huge saving in terms of time. Now, we know that doctors are busy people, but
Mm,
this helps them to make sure that they can remain consistent with creating content.
mm.
So
Ma'am,
one
what do
idea that can be repurposed across platforms, you can make it into a long form YouTube video. You can make it a LinkedIn post if the doctor is active on LinkedIn, or target the audience on Facebook, which is different from the audience on Instagram. And at the same time, if the doctor is confident of sitting in front of a camera, he or she can make a reel out of it. So with one topic or one command, he can create a multi-format post.
multi-level and multi-touch point marketing we can do?
Yes,
So what? So do you think busy doctors should use AI generated avatars, or they should keep it authentic? If they have something to say, then only they should create a video.
I think we should keep it authentic.
Hmm. Yeah.
I think the patient is more interested in knowing the real doctor, the real you.
Hmm.
He or she should let their personality shine. And yes, they are short on time. So, in that case, I would say quality over quantity.
Yes, ma'am, that is true. Uh, so, ma'am, as a woman navigating healthcare and business, what challenges shaped your leadership style?
So, I think I realized early on that uh, trying to micromanage everything, trying to have my hands in everything, and trying to uh, make it perfect is something that's in the long run not going to work. And so I think it's important that you identify people or teams who are aware of your style of functioning or who know what you expect. So
Hmm.
if you assign a project to someone, they should be clear about what the deliverables are. Because if we start dotting all the I's and crossing all the T's, there's very little that will get done eventually. And it's okay to delegate. So that's been a big and a huge learning for me.
Yes, ma'am. Delegation has come up in my previous podcast also, that women try to do everything by themselves,
Yes,
but delegation is a part of growth.
yes,
When you delegate your task to someone else, then only you can focus on what is important.
yes, very true.
So, ma'am, like we have talked about social media, doctors showing up online, but many dentists, many doctors are hesitant to show up online. So, what advice would you give them?
I think it's better to have tried and failed than to have not tried at all. That's something that I've believed in uh, right from the beginning, because I've reinvented myself multiple times, and uh,
Mm,
there were many points when I thought, okay, by doing this I'm probably making a fool of myself, but no, uh, they're just learnings. The
mm,
same way, uh, you need to show up consistently every day. It's a muscle that needs to be worked, and the more you do something, the better you get at it, and it looks effortless. It is
mm,
the nature of things that when you try something new, you may not succeed immediately, but that's the growth curve. You
yes.
make a mistake, be ready to learn from it, learn,
Mm,
do not hesitate to ask for help, And now you don't even need to do that with the advent of AI and good tools at your disposal. But just keep showing up, be consistent, learn, and move forward.
I think it would be a great advice for dentists who are afraid to pivot.
Yes.
So, ma'am, yeah, talking about reinvention in the psychological way, I think what is the major factor for reinventing yourself? Is it fulfillment, freedom, growth?
Again, I'd like to answer this in a way that is relevant to me. For me, it's always been about growth. My journey started, my journey of reinvention started because I felt that I was stagnating and I felt that I wasn't moving forward. So for me, it has always been about growth, moving ahead, moving forward, and not stagnating in one place.
Right? Coming out of the comfort zone.
Yes, yes.
So, which skill from dentistry has stayed with you through every reinvention?
Uh, I think just the rigor, then the ability to work hard, that's something that has stayed with me. So you're a dentist yourself, and I'm sure you remember you've done your BDS, MDS, you
Yes.
remember the amount of work you've put in, the rigor that is required, right? So I think dentistry prepares you for that. So
It's like, was there fear attached to leaving something that you became already good at?
So, luckily for me, I don't really care too much about what others think.
Hmm.
Uh, it's not been something that's bothered me. Uh, but to answer your question very plainly, no, it never affected me. I was very focused on growth for myself as a person, as an individual, and it helps when you're reinventing yourself if you can have a thick skin and not get too bothered by what people are going to say. People are going to talk anyway. So
Hmm.
the sooner you learn to ignore all that noise and just focus on what it is that makes you happy and what you want to do, it's better. So, and you have to be your own cheerleader. That's it.
Hmm. Like, I think even I have struggled with it with the log kya kahenge when decide to pursue something that you haven't been trained for. So log kya kahenge is a major factor of many people getting being stuck at one place.
I would like to, if there is someone who is struggling with this, my advice would be why not take it up as a challenge that yes, I can do it, and a challenge to prove it to yourself, not so much to anyone else or the world or whoever it is that's questioning you, but more to yourself about what you like. I've always said, Anjali, I don't believe that there are failures. I just think that there are learnings. We learn from every mistake. I'm sure we have all heard this, and I resonate with it, that success is overrated.
Hmm.
Failure is where the real gold is, because that's what tests your true character, your resilience. That's where grit is born. So if you're failing at something, it just means that you're trying something, and you only fail when you stop trying.
There's also a famous quote, na ma'am, like you will not fail if you do not try. If you are failing, that means you are trying new things.
Yes,
That is
like I
suggest
just said, yeah.
when we have a fear of lokange, we have to think that we are trying something new at least. We are not even trying to do anything else. We are trying to do something. Even I think the major fear is if I fail, then people will point fingers at me. If you succeed, people will say, "See, she succeeded and it's okay." But if you fail, people that criticism increases.
But why can't we? challenge ourselves and think that what if it works out?
What if it works
There's
out?
always a chance that something works out, and even if it didn't work out, you still, it was never a loss totally, because you still learned something from that experience. You learned something about yourself that you didn't know up till then. So I don't think it was a failure.
Hmm. Ma'am, that there's a Sylvester Stallone story also na, about the Rocky movie. He said that
Yes,
I know how to live in poverty, but if it works out without me, I will have the regret whole my all my life. So he went back in and asked them that, don't give me any money, just let me work on the movie, and it is one of the biggest hits of our time.
yes,
Ma'am, I would want a rapid fire round.
sure.
Yeah. Yeah. So, Instagram, LinkedIn, or YouTube? Which platform should dentists prioritize first?
I don't think there's a fixed answer for this. I would say whichever platform you are comfortable, which works for you, choose a platform that you are comfortable with, where you feel that you have a good connection with your audience, but just be consistent.
I think YouTube is a bit difficult because it prioritizes long form content, and
Yes,
but YouTube is good for when you're trying to acquire patients from abroad for dental tourism. Do you want to shed any light on medical and dental tourism?
I think we are at the right place at the right time. The government is uh, pushing medical tourism in a big way. And this is something I have been repeatedly saying, talking about, posting in the past couple of months. The opportunity exists, but if you are not visible to your target audience or your patients, then you don't exist for them. The onus then is on us to capitalize on this opportunity.
So, how can dentist position themselves for the international patients?
See, Indian doctors have an edge as it is over their counterparts in other parts of the world, just merely because of the experience, the vast number of cases that we worked on, the very fact that we are English speaking, that uh, our education is at par with the education in any other part of the world. So are our treatment options, which are all at par with the global practices. So we need to set ourselves up, we need to put ourselves out there, make sure you have an optimized website so you appear in searches when a person sitting in maybe Australia or New Zealand is looking for affordable implants in India. Make sure that you have a social media presence. Like I said previously, it doesn't have to be on all platforms. Choose a platform that works for you, which you are comfortable with, but just be consistent. Again, you don't have to post regularly, but make sure you post consistently. Patients should get a feel and understand what are the kind of treatments you're doing, what do you specialize in. Post your reviews or your testimonials, post, share before after images. Nothing works like a person seeing the transformation in a before and after
Yes.
case. The results are there to speak for themselves. So these are a few things that I think dentists should do. If they are active on LinkedIn, it's a great place to be, because it gives you huge opportunities to network with professionals, not only within the industry but various industries. So for example, if you are looking at acquiring international patients, gives you a great opportunity to interact with medical tour operators over there. So these are the few things that I think dentists should start doing.
Ma'am, how different is the marketing funnel for local patients and the international patients? I'm sure there are many more steps that international patients goes through to reach us.
So there I would talk about patient testimonials, um, showcasing your work regularly in a way that shows your experience and your expertise, being able to give a patient who's sitting miles away in another country, a glimpse of your clinic, your operatory, ensuring that you talk about all your sterilization protocols, ensuring that you have a fully updated website, a website where they get all the information that they seek, being extremely responsive. If you get a query from them, be it via your website or your social media handles, ensuring that you revert back immediately, so the patient knows that you are active, that you're responsive, and you're proactive. So these are some of the things that are involved in in acquiring international patients.
I think automation also helps here
Yes.
to respond to the patient. Ma'am, one branding mistake most dentists make.
So I've seen that dentists will get spend a lot of money on getting a logo, a good website, signage, work with an agency, and make sure that they're putting up posts, carousels, etc. But there is no sign of the dentist himself or herself. It's important that the dentist show himself or herself to their patients, because how else do we build trust, right? It would be nice to put a face to a name. Let's reverse roles and imagine that I'm searching the internet for a dentist. The dentist is not coming to your clinic just by virtue of your clinic name. He is
Hmm.
coming to you for the dentist, for the doctor or the dentist. And so I think this is one thing dentists need to do, ensure that there is uh, enough of personal branding. Let them see the person behind the clinic, person
Yeah.
who is going to be treating them.
So one daily habit that builds authority over time.
I mentioned earlier that, s- something simple as posting regularly. We
Okay.
don't have to have seven posts in a week, one a day. No, just be consistent. So if you set yourself a target of one post a week, so be it. But make sure that you meet that target. Consistency over perfection any day.
And skill or storytelling, what converts better?
I don't think on its own I can choose any one skill or storytelling. Skill is very much required. But if I were to talk specifically about dentists, I would think storytelling, because many dentists think that this is not for me. I have the
Hmm.
skill, I am a dentist, and this should be enough to get me my patients. But so I think for this particular instance, I would choose storytelling, because they tend not to invest time and effort in this. And I'm sure you agree with me on this.
Yes, ma'am. Like storytelling will lead the patient to come into your clinic, but skill will keep him for life. I would say that.
Yeah, exactly. He's coming to you because of your skill, right?
But with story dentists are good communicators. We learn the communication right from our college when we start handling patients.
Absolutely.
I
We
think we
have,
just
yeah.
need to use that in-person communication online.
We have been breaking down complex information into easy to understand information for a long time. This started when we were training in college itself. So we have
Mm.
been trained to communicate in a way that's very easy to understand. We already have the communication skills. Now they
Yes.
just need to make the effort of sitting in front of a camera and showing up.
Yes, ma'am, that is. I think, but the hardest part, like I said earlier, it's patients have anxiety of a dentist, and dentists have anxiety of social media. Even for me, it took me so long. Like I have building brands for others, but for me to show up on camera, it took me a long time. So I think that is one of the reasons dentists are not as active on social media. But those who will show up will only grow in the future, because it's
Absolutely.
expected. As you are a dental entrepreneur or anything that you are doing, you have to show it online, because that is where the patient acquisition or consumer acquisition is happening.
Yes, I agree.
So how do you summarize your life in one headline?
Okay, let me see. Maybe a student for life, constantly learning and evolving.
Uh, So beyond the dental chair, who are you becoming now?
Becoming a person who is more confident and working to her full potential, always learning and always growing.
So, thank you for coming on the podcast, ma'am. It was a lovely conversation. And the biggest takeaway I took from your life story is do not be afraid to reinvent yourself at any stage of your life. And do not be confined by people's belief about you. You should believe in yourself and believe in what you can achieve with your life. So, do you want to add any concluding phrase to our audience?
Not really, nothing much. You've summed up pretty much everything. But I had said this in response to one of your questions. I'll say it again. It's better to have tried and failed than to have not tried at all. I think the regret of not trying is far bigger than you trying something and failing at it. And what if it works out? There's always that possibility. I hope I have been able to inspire people. Change is difficult, but if you embrace change, it can be one of the most life altering experiences. So thank you for having me so I could share my experience and my journey and the leap, and I wish you all the best.
Thank you, ma'am. I think this is the cue to our audience. This is the permission you need to give yourself to, if you want to pivot your career, you can do it now. Thank you, everyone.